Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teachers module, Caring for a Homeless Patient. The objectives of this module is for the learner to be able to describe a provider's role in assessing patients for homelessness and how to do so, explain the housing first approach to homelessness and its associated health impacts for patients, identify resources with which you can connect patients in order to address homelessness and apply them in a clinical scenario, and discuss how the impacts of homelessness can be considered in a patient's medical care. So to begin with, if you have a patient, the only way to address their homelessness, if present, is to be able to assess for that homelessness and identify it. And currently, we see that within the United States, there is a current lack of housing instability screening. So only 27.8% of physician practices within this study reported screening for housing instability. Hospitals, only 60.1% of hospitals within the study reported screening for housing instability. So that is a great amount of physicians and physician practices and hospitals that are not even taking the steps needed to identify homelessness within their patient populations. And without screening for homelessness and identifying it, they are unable to address it because they don't know it's there to begin with. So how do you screen for a patient's homelessness? You have to start with the patient history. It's a great way to start, especially with the social history component of the patient history. Start with a casual conversation about the patient's current housing status. Some great questions you can ask are, where did you sleep last night? Where are you currently living? How long have you been living there? Would you consider your current housing situation stable? Do you have any concerns about losing this housing in the near future? And is there any health, safety, or violence risks in the place you are currently staying? Now, these are kind of introduction questions, and if you do get responses to them that raise concern or indicate homelessness, you can continue with a more formal screening. And there are written questionnaires out there for this. One example is the U.S. Department of Health and Human Services Housing Assessment Guide for the state TANF and Medicaid programs. But I'm sure there are many more out there that give a similar screening method through a couple questions that you'll have patients either answer orally or written on a piece of paper. And these questionnaires will give you a more detailed idea of the patient's current and past housing situations, any financial concerns that the patient may have, things like the patient's want, desire, or need to leave the current situation and why that want or need is there, the patient's safety in their housing and in relationships, if the patient knows and can identify that they need housing assistance. That's another question that's commonly included in these questionnaires, as well as the current conditions and amenities that are available in the patient's current housing, whether they have access to water, toilets, showers, and refrigeration, whether they have a place to get food, prepare food, and store their food within their housing situations. So once a patient identifies with a brief conversation, whether that indicates their housing instability or insecurity, a more formal detailed screening is good to follow up with to really get the details of this patient's unique individual homelessness experience. And once you have those details and you understand, or at least have a better understanding of your patient's homelessness, you can begin to address it. And the current theory or approach that's being talked about in the United States is the housing first approach. And what this means is that when you have a homeless patient or a patient experiencing homelessness, you want to prioritize access to permanent housing as the first step in that patient's treatment. So first step, you're going to get that patient connected to a more permanent or stable housing condition. And this housing provision that this patient's being connected with is not contingent on a patient's compliance to the treatment plan that will follow that housing, or that housing is not contingent on the patient's substance abstinence if the patient is suffering with substance use. And it's important to note that this housing first approach is not called housing only approach. It's recognized that housing, while it can help a patient a lot in a lot of areas with their health and their medical condition, it's not the 100% cure. It's not the 100% cure for whatever medical conditions they're facing. So in addition to, after you first get this housing, this patient their housing, you're then going to follow up with a treatment plan that a patient will better be able to follow because they have housing, and because that housing is not contingent on the patient's compliance with the treatment plan. And so this housing first approach to a homeless patient has been seen to reduce emergency department visits, lower the patient's hospitalizations, and decrease the time spent in the hospital when there. So we see positive health outcomes with this housing first approach. And this is a great diagram that's included in the reading materials for this module, just laying out housing first. So you have a homeless person that's been identified. You assist them in getting housing and more stable residence, and then you approach the patient's more medical illnesses and issues that they're better able to try to treat within the more stable housing condition, the better access to health, the more independence that they have and ability to live their lives. And then you see the better outcomes. So they have better health and well-being, less comorbidities, less adverse social determinants of health, better health outcomes with this housing first approach to homelessness. And so part of that, in order to do that housing first approach, you have to know how to connect your patient to stable housing. And there are some great local and national resources out there in order to find housing for your patients. You can find more stable short-term housing, subsidized housing, financial assistance, rental assistance for your patients if they have housing but they need assistance with rent. And so the first resource listed here is a directory, a homeless shelter directory that can be used to find a homeless shelter for your patient based on their location. And while not permanent, the homeless shelter can provide more stable short-term housing for that patient. And you can also use Find Help and 211 to find more housing resources. So Find Help will be able to provide both local resources for housing payment help, short-term housing amenities, housing advice, and more. 211, you can find more local resources for housing based on your zip code. So these are really user-friendly resources for you and your patient to work with in order to find them some more stable housing. And when doing so, you should really consider your patient's identity and their needs. So you should be able to, you need to understand whether or not this patient has a family that they're also responsible for housing. So whether you're looking for a housing situation that's just for one person or maybe a family of 5. You should also understand whether or not your patient needs ongoing medical care while they're looking for housing. So there's something called respite care that's provided at a lot of shelters, and what respite care is it's like a step down from hospitalization. So this patient's recovery does not require hospitalization, but it benefits from some sort of structured medical care and provisions that are available at these shelters that offer respite care. So if your patient needs that, it's important to look for shelters that offer that. As well as you should understand whether your patient feels more comfortable in a shelter that's specific to their gender identity or sexual orientation. There are general shelters, there are shelters that are specific to women, men, LGBTQ populations. Make sure that you include the patient in this decision making in order to make sure you find short-term or long-term housing that's comfortable for them. So after you have assessed the patient and identified housing instability and connected them to housing through the housing first approach, it's then, once you have the housing figured out, time to treat the patient's medical conditions and maintain their medical care as you would for any of your other patients. And so with that, you need to consider how homelessness impacts their health and access to the healthcare system in their treatment plans. So when you're taking a history with someone who has a history of homelessness or is currently homeless, talk about their homeless situation, their housing situation and needs, both current and previous within the history. Use the past medical history to talk about conditions that may be more common in the homeless populations to see if this patient may have them, pay special attention to them. Things like chronic conditions, asthma, hypertension, HIV, mental illness, STIs, and foot problems. Use the social history similarly to pay attention to certain social conditions, social behaviors, social determinants of health that are at higher prevalence within homeless populations, like substance use, victimization and safety, health insurance, past experiences with healthcare, and their trust of the healthcare system, any sexual history that they have, and any barriers to contraception that they may be experiencing. So again, you're still going to cover all the bases that you would with a normal patient or a housing secure patient within the history, but you're also going to make sure that you talk about those at-risk areas for homeless patients. Similarly, you're going to do the same thing with the physical exam. You're going to do a physical exam that meets the requirements for the chief complaint that the patient presents with. However, you should also be aware of and take note of and examine certain areas for the homeless populations. So they're at high risk for dental and oral problems. So do a dental and oral exam with a well visit of a patient experiencing homelessness. Do a foot exam. Like I said, they have high prevalence of foot problems and damage to the tissues down there. So make sure to do a foot exam for your homeless patients, as well as a skin exam. Like I said, these patients are, especially if they're unsheltered homeless patients, they are very vulnerable and exposed to the environment. So make sure to examine their skin fully. And again, with you can focus preventative care to be better suited for homeless populations. You're going to maintain normal health maintenance as you would with any patient, if feasible for that patient. There's also special considerations you should take for homeless populations for preventative care. One being getting annual PPDs. So tests for tuberculosis, annual or semi-annual, especially for those who stay on the streets, who are staying in shelters, who use food lines, and who have been in the criminal justice system. You should also consider certain vaccinations and really recommend them for your homeless population patients. So that are pneumococcus vaccines, hepatitis A and B, flu, tetanus, and COVID vaccines, because living in shelters or areas that communicable diseases can be transmitted more commonly, vaccinations really benefit these populations from preventing illness. And lastly, you should also, in preventative care, consider risk reduction strategies for illnesses like STIs and also behaviors like injection drug use and the complications that can have. So whether it's needle exchanges or having contraceptives available for your patients in order to reduce these risks. really take into consideration homeless patients, their experiences and their conditions, and how you can tailor preventative care to fit those. Again, you're going to do the same thing with prescriptions. Homeless populations may not have reliable access to the healthcare system, including pharmacies, but they also may not have the conditions or situations that permit a medication regimen that a housing secure patient has. So they may not have refrigeration for medications like insulin. So preferably, you want to figure out a medication regimen that does not require refrigeration and that does not require laboratory checks for homeless population patients. You should also try to minimize medication doses. Ideally, you want your homeless populations to only have to take their medications once daily. So looking for regimens that fit that. Consider the expense and availability of these medications. As I said in my previous presentation, poverty is a high risk factor for homelessness. So a lot of homeless individuals do not have the financial means for all these medications. So consider that when choosing your medication regimen. Also, try to avoid undesirable side effects. A huge one with the homeless population is urination. So with medications like diuretics for hypertension or congestive heart failure, anytime you're using a medication that increases someone's need to urinate, homeless populations might not have access to bathrooms reliably. So that's just one example of an undesirable side effects that can more severely impact a homeless population patient. And lastly, ask the patient about their specific adherence to the medication regimen that you've created and any barriers they may be experiencing that are preventing adherence to this medication regimen, and work together to figure out the best medication plan and treatment plan for that patient. Just to wrap up with some things to remember when medically treating a homeless population is that they're not a homogeneous group. Every homelessness experience is different for each patient. Get to know that patient, get to know their experience and their medical conditions and how they all are interwoven. Regularly update contact information. As someone who may not have a home base for them and or their family, figure out what is the best way to be in touch reliably with this patient, whether it's their cell phone if they have one, whether it's a contact information for a family member or friend that can reliably get in touch with this patient of yours. Make sure you have up-to-date contact information. Also, make sure to document the patient's social needs in the medical records so that if the patient goes to see a different provider, specialist, or someone else at the same clinic, or a new provider, that is in the system and that provider is aware of it. Don't penalize patients for no-shows if they don't have the means to get there. Instead, ask them what is preventing them from coming to the appointment so that you can work together to fight those barriers. Take into consideration the patient's health literacy level. We do see rates of low health literacy within homeless populations, so take that into consideration when you are communicating with the patient, creating treatment plans with the patient, and so forth. Lastly, be realistic with your community resources. It's fantastic to try to connect these patients to community resources, but be realistic with the patient's means, abilities, location, and all of that to make sure that the treatment plan that you're creating for this patient is realistic and achievable. This is our presentation on homelessness, caring for a homeless patient. Now I'm going to just take us to those resources that I had recommended for us to use to connect patients to stable housing. The first is the Homeless Shelter Directory. And so that will take you to this website. And you can choose any state you want. So say we choose California. And it'll give you a complete list of California's shelters for homeless populations by city. So you can choose the city that the patient lives in or a nearby city, and then figure out what shelter would work best for them based on the description of the shelters provided. So each shelter is listed, the location, details about it, so that you can get more information about the center, their phone number, website, and connect patients that way. The next resource that we've provided is findhelp.org, which can be used for a bunch of other resources, including housing. So say we are looking up housing options for a patient in that zip code. We're going to enter the zip code and then go to housing. And like we said, we see help paying for housing, housing advice, housing repairs, residential housing, temporary shelter. We've got so many options for all of these. This is a great option for a variety of resources for your patient's housing. And lastly, 211, which is very similar to Find Help. You are going to find your local 211, enter your zip code. And it'll take you to the local state page. The website is not working right now, but you'll enter your zip code and it'll show you, it will take you to the state page for that 211 service, as well as then you can enter in the type of service you'd like, so housing, and then it'll provide various housing options, shelters, and so forth for that patient in their local area to be connected to. There are more tools and resources in the syllabus for assessing, addressing, and connecting your patients with housing options. Thank you so much for listening.